Welcome to our recorded outbreak series. The IPAC Hub of the Thunder Bay District Health Unit is an education-focused team whose main goal is to support our congregate living settings in infection prevention and control. Module 1 will discuss the outbreak process and general IPAC measures we implement for all outbreaks. Make sure to take your time completing this module and feel free to pause when needed, as this is a pre-recorded session. Here is a view of each of the modules that are available within this outbreak series. Because this series is pre-recorded, please feel free to stop or start at any time or only watch and listen to the specific sections. You can also locate all of these modules on our website or use this QR code to bring you there. This module was last updated in March of 2025. Here is an outline of this module. First, we're going to provide an overview of outbreaks and discuss the types of outbreaks. Then we're going to discuss outbreak management and the outbreak management team, the outbreak process, and general outbreak measures. By the end of this module, participants will be able to identify members of an outbreak management team and their role during an outbreak, understand the outbreak process, and implement initial outbreak measures to prevent further spread. So IPAC, being an acronym itself, tends to also use a lot of acronyms, so we just started to collect some here just in case any of them are new for you. So please review this list of some common terms and acronyms, as you might see these throughout the different modules. So before we dive into more specific topics, we're going to warm ourselves up with the basics. So what is an outbreak when talking about our facilities? Simply put, an outbreak is defined as an increase in the number of sick people beyond what is normally expected, and this is based on surveillance data or data that has already been previously collected. Generally speaking, we can further differentiate all outbreaks into two categories: respiratory and enteric. Respiratory outbreaks involve the upper and lower respiratory tract and typically spread person to person. The Ministry of Health and Long-Term Care has now categorized respiratory infections into acute respiratory infections, or ARIs, influenza, and COVID-19 for guidance measures. Enteric infections involve the stomach and gastrointestinal tract and can be caused by food or water contamination or person-to-person spread. Respiratory infections include upper and lower respiratory tract infections, which can affect a person's sinuses all the way to their lungs. Symptoms can be a runny nose, congestion, sore throat, cough, shortness of breath, and generalized malaise or fatigue. Respiratory tract infections are commonly diagnosed infections in long-term care and congregate care residents. Data from the Public Health Ontario lab specifies the most common respiratory viruses causing these respiratory infection outbreaks are influenza A and B, enterorhinovirus, coronavirus such as COVID-19, RSV, parainfluenza, and metapneumovirus. Enteric infections can be caused by bacteria, viruses, or parasites contracted through contaminated foods, beverages, through contact with contaminated items, or infected persons. Enteric outbreaks can be caused by any of these infectious agents and may also be referred to as gastrointestinal or gastroenteritis outbreaks. The most common enteric outbreak within our congregate living setting is norovirus. This typically presents with a sudden onset of abdominal pain, nausea, vomiting, and diarrhea, with general malaise and aches and pains afterwards. It spreads quickly as only a small amount of the virus is needed to infect the next person. Symptoms are sudden and sometimes severe.
We can now generally define an outbreak as an increase of illness within a defined period of time. We also know our facilities can experience different types of outbreaks. With these building blocks established, let's now dive into the outbreak process. What steps does your facility need to achieve to prepare and manage outbreaks? There are 6 areas of outbreak preparedness and response we are going to discuss in this module. Preparing ahead of time, identifying early, notifying public health, taking initial steps, preventing further spread, and debriefing for lessons learned. We're going to break down each of the steps within this presentation. Preparedness is key. It is something that no one wants to do and feels mundane, especially if you're lucky enough not to go into an outbreak. But it does make a difference if you do experience an outbreak, and that is why it's worth the effort for you to be prepared. So, planning and preparing ahead allows the facility and the staff to feel calm and confident in their plans, rather than stressed and anxious while trying to figure out the next steps or find their resources. In order to prepare, the following should be considered. Your policies and procedures may be needed to be updated. Guidance for our congregate living settings continue to change. In 2024, we had 2 changes to our guidance document for outbreaks, and already in February 2025, we've had an update. There likely will continue to be updates and revisions to this document. At very minimal, policies and procedures should be reviewed annually and as needed. So if guidance changes come out, that's when you would also want to update them as well. You want to ensure that client medical directives are put in place and all necessary consents are signed in advance to the outbreak season. Typically, we say in advance to October. This allows for antiviral administration, either being COVID or influenza, which is time dependent for it to be effective. Necessary outbreak supplies include signage, personal protective equipment stations, alcohol based hand rub, or additional hand washing stations, alternative disinfectants, and could also include lab collection tests kits. Staff and clients' immunization records must be kept current for risk assessments. Staff ability to work on site or in specific locations in the facility may be affected by the immunization status during an outbreak. Staff are the forefront of the outbreaks, therefore, they need to know their roles, expectations, but also feel confident and supported during this. Ensuring they know the policies and procedures and who's responsible for them is key to ensure a smooth outbreak. It's also important that they've been given opportunities to attend education. Although a lot of navigating outbreaks is through learned experience, having some knowledge and support going into it will make it a better experience for all. The second step in the outbreak process is early detection. It is critical for frontline staff to know what to look for and who to report it to. They should be aware of who within the facility they need to bring the information to. Is it a floor supervisor, an RN in charge, or is it a group home supervisor? Ensure staff know who this person is and that this is included in part of their orientation and ongoing education. Once information is brought to the designated staff's attention, a suspect line list should be started to monitor any affected residents or staff and keep track of any spread. We will go into line list details later within this presentation. Line lists are a visual aid to help identify outbreaks and epidemiological links when looking at illnesses. The third step in the outbreak process is to notify the Thunder Bay District Health Unit as soon as an outbreak is suspected. TBDHU staff, most likely the public health nurse assigned to your facility, will review the line list and help prepare if an outbreak is confirmed. They will determine and declare an outbreak as appropriate. This will be done by developing a case definition. A case definition list includes the clinical criteria used to determine whether a person's illness is included as a case in the outbreak investigation. They can also provide an outbreak number and specimen collection kits to your facility. Public health will assist in sending out notifications to external stakeholders. This would include public health laboratories, healthcare providers, or ambulatory care notification. The health unit or public health staff will also provide guidance for outbreak management, review your facility's influenza and COVID immunization rates during the respiratory outbreak, and provide guidance on this as well. So they're going to be with you every step along the way. So the sooner you can get them involved, the better. never ever think that you're wasting anyone's time. We would rather know ahead of time than last minute and us scrambling. It's better to be transparent and work together as it develops. Once the Thunder Bay District Health Unit has been notified, they can work with the facility to determine if the suspect outbreak can be declared over or confirmed and declared as an outbreak. Typically, an outbreak management team or an OMT is created or already has been created by this time. The outbreak may be declared between the facility representative and the health unit nurse, or declared during the initial outbreak management team meeting. The OMT will manage communication of the outbreak declaration. An outbreak management team is a multidisciplinary, multi-organizational team who will oversee the outbreak, decide on control measures to be implemented, provide outbreak communication, and navigate any unique situations that may arise. The first outbreak meeting should occur at the declaration of the outbreak or within 24 hours of its declaration. For example, if you're declaring an outbreak during the evening or overnight shift, the meeting might not be till the first thing the next morning. Or if it's on the weekend, it may not be until Monday morning. It is ideal to hold it as soon as possible to ensure any important information is communicated and measures are put in place to stop any further spread. So the initial or first outbreak meeting is the most important, as it typically provides a case definition, initiates a response, and staff. Studies have proven that the quicker the response is put in place, the less negative impact an outbreak will have and contain the outbreak to one area or one facility. At the initial meeting, a regular schedule for further meetings should be put in place. Depending on the organization's familiarity or experience with outbreaks, the type of outbreak could be a few factors that could determine the frequency. It is ideal to meet every few days to discuss the outbreak as a team. However, the public health nurse and the facility representative will likely be in communication daily. So the outbreak management team meetings are with all the partners, organizations, facilities, so that they may discuss the ongoing issues. So dependent on the type of facility you're affiliated and the size of your facility, this could depend on who is a part of your outbreak management team. So key members of the team from the facility should be those who are able to make decisions and or manage staff. So this could be a floor manager, a home supervisor, an IPAC lead. Um, it also should be multidisciplinary. The larger the facility, likely the more participants, as one individual doesn't hold multiple roles or titles. A Thunder Bay District Health Unit infectious disease nurse is assigned to the facility, will also attend. Members from the IPAC hub team, and sometimes you might see some additional members such as public health inspectors, senior nurses, managers, or directors, depending on the type of outbreak, the extent of the outbreak, or providing coverage for teams. One of the steps that comes with declaring an outbreak is providing communications to additional stakeholders. The affected congregate facility is responsible for notifying their residents or clients, the family members, staff, and volunteers about the outbreak and any pertinent details. Having a standard script for communication will assist all staff in providing the same clear and concise message. The outbreak management team will help decide if a community announcement or communication is required. Typically, public health or the health unit will do a media release on behalf of the facility. So that's if you're open to the general public. You'll see a lot of times our long-term care homes or retirement homes outbreaks are posted within our websites. And that just allows people who are maybe coming from out of town to check before they make that trip if they're unable to communicate with the facility. And because there can be such a variety of people coming into the building, it also assists that ensuring people know ahead of time.
Facility signage is an important means of communication and should not be overlooked. Outbreak signage at the entrances of the facility is required to notify all individuals entering, including contractors, visitors, etc., to indicate that there is an outbreak and if it is facility-wide or which units or areas are in outbreak. The affected units or areas also need to have signage. This includes all access points, such as elevators, staff entrances, stairwells, etc. Signage should be distinct, clear, and bright to grab attention. Signage for individual client rooms is also required. We will go into further discussion on this later. A line list is a table that summarizes information about cases associated with an outbreak. There should be a master line list of those residents who meet the set case definition. If the case definition has not yet been established, it would include anyone experiencing symptoms and adjusted after case definition is met. A resident doesn't need a positive test to be added to the line list, just meet the criteria. Keep staff and resident line lists separate to prevent confusion and simplify reporting. Lists must be reported daily to the health unit public health nurse. Typically, a time to have them submitted is established at the Outbreak Management team to allow the public health nurse to review the list daily. For example, you may decide by 9 a.m. daily and Monday through Thursday, your outbreak meeting is at 10 a.m. It is best practice for facilities to keep the same lists as the health unit to ensure no information is missed when transcribing between lists. This is an example of a client resident line list for respiratory outbreak. You'll see how important information is captured at the top, the outbreak number, facility, and dates. Enter full names, as some clients may have the same initials or last names. If there are shared rooms, ensure a bed number is added. Some will add a numbered list so they can refer to clients by their number and initials in emails to limit personal information disclosed through correspondence. We can't stress enough that when specimens are collected, ensure you record the date on the line list. This is a commonly forgotten piece of information. This is an example of a staff line list for an enteric outbreak. When looking at the line list, the unit or work area would be the department they work for and/or the floor or unit. Date and time of last shift is important information to decide when staff are allowed back to work or to determine a date to declare an outbreak over. It is highly recommended that line lists are carefully reviewed prior to outbreak meetings. Any concerns can be brought forward to the meeting. Ideally, one person or position is in charge of the line list during the outbreak to ensure consistent and accurate reporting. For example, a nurse supervisor. The health unit will typically provide specimen kits for collection, but some facilities may have their own. This is to be discussed when you notify the health unit about the suspected outbreak or at the initial outbreak meeting. If you are a facility where kits are kept on site, ensure they are stored properly and checked regularly for expiry dates. Generally speaking, specimens should be collected early in the course of clinical illness to increase the likelihood of detecting a causative agent. Specimens should be collected from the most symptomatic and/or the most recently symptomatic, as these specimens have the highest viral or bacterial load, resulting in a higher detection rate. If you have access to rapid COVID swabs, also known as RATs, they may be used to help identify causative agent or start clients on antivirals. However, MRVP or regular viral swabs should still be submitted to public health lab for a definitive identification. Enteric samples may be difficult to obtain due to the nature of collection, so make resources, such as toilet hats for collection, available to aid in the collection of specimens. Detecting a true causative agent can change outbreak control measures and the length of an outbreak. Specimens must be collected appropriately so the lab can complete testing. Ensure the lid of the collection container is on and fastened firmly, and the specimen is labeled and packaged correctly. Labels and requisitions must be complete, not just initials. You must include a full name, symptom details as appropriate, and an outbreak number. Each specimen must have 2 different client identifiers for a lab to be able to process it. Include the outbreak number on each requisition to signal to the lab to prioritize the outbreak specimens and report the results back to your facility and the health unit so that no results go. As the final step in the outbreak process, an outbreak debrief meeting is highly recommended. The decision to have an outbreak debrief would be determined before the outbreak is declared over. A debrief meeting is a great opportunity to reflect on the outbreak, what was done well, and what could be done to make improvements for future outbreaks. This could be the catalyst for changes in policies and protocols or future preventative actions. Debriefs help you prepare for next time, as unfortunately there will always be a next time. Outbreak debriefs are required for lengthy outbreaks that have a large secondary transmission rate, and minutes should be taken by a facility representative for future reference.
In our outbreak process overview, we skipped over number 5 and will now elaborate on preventing further spread in more detail in the next portion of our presentation. The goal of the outbreak management is to support those infected and to stop the spread to additional clients. Infection control practices or measures can be initiated when an outbreak is suspected or confirmed to reduce infection spread. Routine practices, which emphasize the standard level of care to be used by all care providers, are based on the premise that all clients are potentially infectious. Routine practices are used at all times, not just in outbreak. However, they should be emphasized by the outbreak management team to frontline staff when there is an active outbreak. Hand hygiene is the number one way to prevent the spread of infection. The routine practice of hand hygiene must be performed by those providing direct care and must be encouraged and promoted with visitors and clients to reduce the spread or transmission of infection. There are 2 methods of killing or removing microorganisms on our hands. The first is hand sanitizing with a 70 to 90% alcohol based hand rub. The second is washing your hands with soap and warm water. Both are important and both should be utilized. The hands of care providers are the most common vehicle for the transmission of microorganisms. This could be from client to client, client to equipment or environment, and from the environment to the client. Care providers assist multiple clients throughout their day and can be the link between them. Providers use shared equipment and shared environments, such as shared rooms, and can transfer microbes from the client to these surfaces. The provider could then transfer the microbes from the equipment and the environment back to the client. During the delivery of care, the provider's hands continuously touch surfaces and substances, including inanimate objects, client's intact or non intact skin, mucous membranes, food, waste, body fluids, and the provider's own body. Without proper hand hygiene, the risk of transmission is extremely high. So, we talked about transmission, how to perform hand hygiene, and what we need in order to do it. Now, we're going to discuss when we should be performing hand hygiene. This can be referred to as the moments of hand hygiene. Recall that transmission can occur by contaminated hands. The moment of hand hygiene is meant to break the chain of transmission. Our hands are the vehicles that can be used to transfer infectious agents between clients, clients and environments, clients and ourselves, environments and ourselves. So, adding a moment of hand hygiene, whether it's washing with soap and water or using alcohol based hand rub, removes the opportunity to transfer the infectious agents. In healthcare, we talk a lot about the 4 moments of hand hygiene, which are directly related to the client and their environment. These 4 moments are before initial patient or patient environment contact, before an aseptic procedure, after body fluid exposure risk, and after patient or patient environment contact. Performing hand hygiene during these 4 moments protects the patient against microorganisms. Although these moments are incorporated into regular health professional studies and practices, these moments can also apply to all staff within congregate settings. Outside of the 4 moments of hand hygiene, there are numerous other times we should consider performing hand hygiene. Some examples include before preparing, serving, or handling food, before having your break, before touching clean PPE, and before using a shared device. Some additional after moments include after preparing or handling food, after having your break, after using the washroom or after assisting a client in the washroom, when you're donning PPE, after using a shared device, and after touching garbage. Routine practices include hand hygiene and routine use of PPE, but also extend to other elements such as a point of care risk assessment, environmental controls, and administrative controls. The consistent and appropriate use of routine practices by all healthcare providers with all patient encounters will decrease infection transmission in the healthcare settings and reduce the need for additional precautions. As we know, routine practices are the standard to be used at all times. Additional precautions are measures used on top of these routine practices. Additional precautions are for clients known or suspected to be infected or colonized with certain microorganisms. These additional precautions are put in place to disrupt the known or suspected mode of transmission. Typically, additional precautions are implemented when a client is experiencing symptoms or the client has had a known exposure to an agent. Some examples of additional precautions, which are also an important part of outbreak control measures, include signage, accommodation, so private rooms or cohorting, additional PPE, dedicated equipment, additional cleaning, limited transport, and communication to staff and visitors. Over the next few slides, we are going to break down routine and additional precautions into more detail. Additional precautions are often based on the mode of transmission of the known or suspected agent. Typically, these are labeled with signage as either contact, droplet, airborne, or a combination of the three. Contact precautions means that contact with infectious material can result in transmission of disease. Droplet precautions refer to infectious respiratory droplets, therefore, the respiratory system needs to be protected. Airborne precautions also refer to the respiratory system, but with greater protection due to the smaller droplet size of the infectious particle. Now we're going to discuss hand hygiene during an outbreak. So, what changes with hand hygiene when an outbreak occurs? The practice doesn't change, nor the moments of performing hand hygiene. However, the frequency of hand hygiene will change as there are going to be more clients on additional precautions, which directly increases the moments of hand hygiene. There will also be an increase of hand hygiene by clients and visitors, and this is encouraged during an outbreak to reduce any transmission. Any facility in outbreak should consider the following. Ensure your facility has an adequate supply of alcohol-based hand rub and all other hand hygiene supplies for use during an outbreak. Make sure products are placed in the appropriate places throughout the facility for optimal use, such as outside of client rooms, break rooms, and dining areas, and ensure that areas that are staff use only still have alcohol-based hand rub available. Assigning someone the responsibility of refilling the soap and alcohol-based hand rub on each shift is important as we should not be running out of these products, especially during an outbreak. If your facility is unable to utilize alcohol-based hand rub from wall units or unable to leave alcohol-based hand rub out in the open, you can have staff carry a small container of sanitizer in their pocket instead. It is also important to increase auditing of hand hygiene practices along with donning and doffing PPE practices. For auditing, direct observation refers to observing the practice of performing hand hygiene or donning and doffing PPE, whereas indirect would be looking at the usage of products.
Our second routine practice is the use of PPE or personal protective equipment. PPE serves as an additional barrier to potential exposure of infectious agents and should be used appropriately depending on the care being provided at any time, not just in an outbreak. This is what makes it part of routine practices. All care facilities must provide an adequate supply of easily accessible and appropriate personal protective equipment to protect staff, volunteers, and students, as well as visitors, from contact with blood and other body fluids, secretions, for example, nasal secretions, excretions, for example, vomit, and non-intact skin, for example, a wound that is open. PPE includes the use of a mask or N95 respirator, eye protection, gloves, and gowns, to be used appropriately depending on need. The use of PPE should not be new for your staff, but when in outbreak, the moments of PPE use can go up exponentially, and this can be confusing. For staff who have never experienced an outbreak, cared for individuals under additional precautions, or simply need a refresher, this is where training would benefit all. In addition to ensuring your staff are appropriately trained, audits of routine practices should be performed. If audits are routinely done, the number should be increased during an outbreak. Infection control audits are an ongoing review of a setting's processes and infection and prevention control practices. Audits verify all IPAC best practice are being followed by all staff. In outbreaks, it can be extremely helpful to increase the amount of audits being performed in outbreak areas for practices such as donning and doffing PPE as well as hand hygiene. Auditing these practices and doing in-the-moment education can increase compliance and help keep staff and residents safe. So we've talked about PPE and auditing PPE. We'll now discuss the principles of a PPE cart setup. PPE carts or stations hold all the necessary supplies required to implement additional precautions. The PPE station needs to be set up at the first sign of symptoms. That means the first symptom, and should not wait for an outbreak to be declared. Additional precautions are based on the client's symptoms, not the outbreak declaration, and are to stop the spread at first sign. PPE carts or stations should be located outside of the room of a symptomatic resident or within the immediate vicinity and visible from the door if stations are being shared. Get ahead of any outbreak that may occur. Have PPE stations stocked and store signage along with them. Keep them clean. Don't use the area with PPE stations for storage of other items, and ensure that contaminated items, such as used slings or garbage, are not touching the clean PPE or the containers used to store it. In past outbreaks, poor implementation of signage and PPE carts has significantly impacted both the length and outcomes of outbreaks. If carts are placed too far away from resident rooms or not stocked with proper supplies, this may confuse staff who may become unsure of which precautions they should be following or increase the risk to their safety by entering client rooms without all the required PPE. Lack of alcohol-based hand rub at stations or on their person can cause missed moments of hand hygiene and increase risks of transmission. If signage is not posted and thereby not identifying where additional precautions are required, doffing signage with a PPE cart or donning instructions with the garbage. These situations again create confusion and could result in a misstep during these processes. What we see most is doffing garbage in contact with a PPE cart and dirty PPE touching the clean cart. This causes cross-contamination, and there needs to be a clear separation of the two. If the garbage for doffing is too far away, this may lead to individuals walking through clean environments while wearing soiled PPE and can also result in increased spread. Signage is very important in outbreaks, and it is crucial to have it in place as soon as possible. Prepare for outbreaks by having additional precaution and outbreak signage ready to put up and in adequate supply. This saves time compared to finding a computer file, printing, and laminating when a facility is already in outbreak. Use of plastic sheet protectors makes it easy to change signage if needed. For example, if an organism is identified after implementation of precautions due to symptoms. And it also allows for the outside of the signage to be wiped down as needed. Ensure the signage works for your facility. There is a lot of signage developed for long-term care and acute care that hasn't always been compatible with our other facilities. At the Hub, we have developed some signage and it is available on our website for you. If you find that there is not adequate signage or something else you need, we invite you to let us know what is lacking and we can help develop something for your use. Signs should always be bright and to the point. Bright to attract attention and differentiate from other daily signage. Clear and direct so anyone approaching an area or room in outbreak can follow easily. Ensuring your facility has adequate signage and is able to have it in place quickly prevents confusion and contains the spread more rapidly. Signage for PPE stations should be put with the station or where the user can easily see it, not across the hall behind the user when they are standing at the station. Donning signage would be with the PPE station and doffing signage with the garbage can. This identifies what the stations are for and assists people with following best practice.
Next, let's talk about some environmental cleaning control measures. Environmental or housekeeping staff should cohort. So these staff are in direct contact with infectious material, similarly as direct care providers. So ensuring dedicating the cleaning staff to the outbreak area, ensure they're only working in that area will help any potential movement of contaminated items going into a non-outbreak area, or from the staff member maybe who's incubating and spreading it to the others on a unit that doesn't have control measures. It is also important to consider the number of cleaning staff in the outbreak area and make sure that it's sufficient to keep up with the rigorous cleaning requirements. So when staff are working within the outbreak area, the staff should move from the well clients to the ill clients. That way, if there is a break in precautions such as hand hygiene or a break in PPE or contamination of equipment, it reduces the risk of moving that illness from the ill individuals to the well because you are moving from the well to the ill. This could look different at every facility because some of our small facilities only have one area, no units, so the whole facility would be an outbreak. So you wouldn't have designated areas, but that's when it becomes really important that you are working from the well to the ill residents. So environmental cleaning staff do have the ability to infect other clients just as much as an individual who provides that direct care. We see this occur often with with daycares. If we see a vomit spill, so if there's improper hand hygiene or PPE use, we can see a big spread of illness. Speaking of PPE or personal protective equipment, it's very important for cleaning staff. You want to ensure that they follow all proper practices. And it's perhaps not a process that they may use daily, depending where they work and how much exposure they have. So the staff may need to be education refreshers on this and how to do it. So you want to include that they know how to use the gowns, gloves, and masks and eye protection when they're cleaning clients' rooms, and that they do adhere to all strict hand hygiene practices. Again, it's really important to look at the number of staff. During an outbreak, there is a lot more cleaning that is required to keep that outbreak under control or keep it from spreading. And it can be dependent on the type of outbreak too. Also, you could have a lot more garbages. So from the use of PPE, there are more garbages to empty. If there's more spills, there's more spills to clean up. Laundry, there could be a lot more laundry to consider. So with all this extra workload, it's typically you do need additional staff to be able to keep up with all the requirements. So planning staff retention or additional staff is an important part of our outbreak planning stage. Another thing you have to check on is ensuring that the cleaners and disinfectants that are being used are selected to effectively kill the suspected or confirmed infectious agent. So always read the fine print, ensure you have that correct product. And if you have an environmental cleaning manager, they'd be able to let you know if it's proper or not. If you don't, you're always welcome to reach out to us here at the IPAC Hub. Or if you have a public health inspector affiliated with your facility, you can always reach out to them as well. So when we're talking about laundry, we want to ensure PPE is also be included in this area. So personal protective equipment is also important, just like environmental cleaning staff, also to laundry staff. You want to ensure that they're educated and re-educated routinely to ensure that they feel comfortable how to put it on and take it off, so they're not contaminating themselves and putting themselves at risk or anyone else at risk as well. They also have to have adequate access to it at all times. So with soiled linen, you just kind of want to limit the amount of sorting being done if possible, especially within a client's room. So if you just need to bag it and get it out of there, sorting can be done later on, but ensuring that you have the proper PPE on. If you don't need to sort it, just throw it right in. Because you might kind of minimize the amount of contact you have with it. And the main thing here is hand hygiene practices. So again, really important for the hand hygiene. Try not to mix soiled laundry with other laundry. And if you're doing a heavily soiled within the laundry facilities, always do a empty bleach cycle after to clear anything out. So to wrap everything up, we just want to talk about some of the amount of resources available to you as well. So there is a large amount of resources available for infection prevention and control, specifically geared to long-term care homes and retirement homes, typically geared to both of you or can be utilized for both. So the infectious disease team here at the Thunder Bay District Health Unit continues to keep their website up to date with the most current information and also states the last date of the update on their website so all users are aware. So when we took the screenshot the last time it was updated, it was November 29th. But you'll see that change with time as well. So you can go to their website if you're not sure exactly how to get there or you haven't saved it yet. You can always type in www.tbdhu for Thunder Bay District Health Unit.com and search just outbreaks in the search bar, and you can bring this up there, or you can actually take your phone or device and you can scan the QR codes with your camera, and it will link you right to this page as well. So if you go on here and you see outbreak management resources for long-term care, retirement homes, and public hospitals. So right on there is going to show you all the little things we have here. So I'm just going to bring you to the next page where we can see more of the page here. So as you scroll down the screen, you'll see all these tabs which have resources under them and links under them. So for an example, if you click on the line listing forms, it'll drop down and you'll have the resources. So an enteric outbreak line list for residents, and then a separate line list for staff, and the same for respiratory, one for residents and one for staff. And then there's an end of outbreak reporting form. If you're looking for signage for your facility, you can click an outbreak signage. You'll see a confirmed outbreak entry sign. If you're suspecting an outbreak and you want to make people aware, there's a sign for that as well. There's also a link back to the IPAC Hub website that has posters and different resources. So we've, under request, made a bunch of different posters or resources, or ones that we haven't found through Public Health Ontario, or more specific for our region. So yeah, there's tons of resources. If you take some time, if you're watching this, I would recommend that you pause now, find that website, spend a little bit of time looking at the resources that are available to you, going through them, and then that way you know where to find them. You can download anything right now that you want. You can save them to your favorites so they're easy for you to access. And the other main resource is going to be our guidance document, the recommendations for outbreak prevention and control in institutions and congregate living settings. This has been updated a few times through 2024 and just recently updated again in 2025. I have also included the QR link here that you can again scan and bring you right to it. This is the important document as we go into the next module, as this is geared specifically for the specific control measures that we're going to go into next, but also touches on all the generic control measures that we spoke about today too. So just to summarize, there has been a lot of information provided in this module, but some general take-home messages that we want you to have is be prepared early. So have a plan in place, have your supplies ready, have it easy to deploy. It makes outbreaks go smoother. It reduces the time you're in outbreak. It makes staff feel motivated as well. Ensure that your staffing levels have been considered. Again, there's extra work that goes into an outbreak. So making sure you have enough staff, that you have retention staff, and that you're looking at it ahead of time. Ensure that you have adequate amount of supplies, that you have the right supplies, and ensuring that they're not expired and they're easy to access for everyone who needs to use them. Evaluate your activities and be prepared to adjust, postpone, or cancel them. Ensure clear directions are provided to everyone involved, directly or indirectly, with the outbreak. So that's the communication piece, ensuring your staff are aware of what's going on, your clients, the family members, visitors, anyone utilizing the facility, and then your community partners, so Public Health Lab, Thunder Bay District Health Unit, ambulatory care, etc. Good. Okay, so we'd like to congratulate you that you have finished Module 1 for the Outbreak series, which was geared to long-term care homes and retirement homes. There is a second module for long-term care homes and retirement homes, and these are the more specific control measures depending on the type of outbreak you have. So this just gave you a generic for any type of outbreak, and then we're going to go into specifics next. So you can go ahead and use that QR code to jump there now, or you can go back to the main site and go to the next one. Thank you.